Coma, a state of profound unconsciousness. Patients lie still, eyes closed, unresponsive to the world. They appear asleep, yet they cannot be awakened. Their bodies may show reflex movements, but purposeful actions are absent. Coma is a serious medical condition. It arises from a disruption to the brain's normal functioning. This disruption can be caused by various factors, including traumatic brain injury, stroke, severe infections, and drug overdoses. The severity and duration of coma can vary greatly. Some patients may emerge from a coma within days. Others may remain in this state for weeks, months, or even years. The outcome is uncertain and depends on the underlying cause and the extent of brain damage. Coma is a complex phenomenon that has puzzled physicians and scientists for centuries. While medical science has made significant progress in understanding the neurological basis of coma, the subjective experience of those in this state remains largely a mystery. Consciousness, the state of being aware of oneself and one's surroundings, is a fundamental aspect of human existence. Yet its nature and the mechanisms that give rise to it remain elusive. In the context of coma, the question of consciousness becomes even more perplexing. Several theories attempt to explain the possible experiences of individuals in a coma. Some propose that consciousness is completely absent during coma, with the brain essentially offline. Others suggest that while awareness of the external world may be lost, some level of internal consciousness might persist. One theory posits that the brain, even in a damaged state, might generate its own internal reality. This could manifest as dreams, fragmented thoughts, or sensory experiences unrelated to external stimuli. These theories, while intriguing, are difficult to test empirically. However, advancements in brain imaging techniques and the study of personal accounts from coma survivors offer glimpses into this enigmatic realm. While scientific understanding of coma remains limited, the accounts of those who have emerged from this state provide compelling insights. These stories, though subjective, offer a unique perspective on the possible experiences within the silent world of coma. Some individuals report complete blackness, a void devoid of any sensations or thoughts. Others describe vivid dreams, often surreal and emotionally charged. Some recall hearing voices, feeling presences, or experiencing a sense of detachment from their bodies. One common theme in these narratives is the distortion of time. Days might feel like minutes, or minutes might stretch into an eternity. While these accounts are difficult to verify objectively, they highlight the possibility of subjective experiences during coma. Electroencephalography, EEG, and magnetic resonance imaging, MRI, have become indispensable tools in studying brain activity in coma patients. These technologies allow researchers to peer into the silent world of the comatose brain and glean clues about its functioning. EEG measures the electrical activity in the brain through electrodes placed on the scalp. In coma patients, EEG patterns often show a slowing down of brain waves, indicating reduced neuronal activity. However, some studies have reported bursts of activity or specific patterns that correlate with awareness or the processing of external stimuli. Functional MRI, fMRI, goes a step further by measuring blood flow in the brain, which reflects neuronal activity. fMRI studies have shown that some coma patients exhibit brain activity in response to sensory stimulation or commands, even in the absence of outward responses. These findings suggest that the brain, even in a comatose state, might retain some capacity for processing information and responding to stimuli. Section 5. The Dreamweaver. Dreams, Visions, and Hallucinations in Coma. Dreams, those enigmatic nocturnal journeys into the depths of our subconscious, are a common human experience. But what about dreams in the context of coma? Anecdotal evidence from coma survivors suggests that dreams and hallucinations are indeed possible in this state. Some individuals report experiencing incredibly vivid and realistic dreams, often blurring the line between dream and reality. Others describe visions, both comforting and terrifying, that seem to emerge from the depths of their unconscious. Deprived of external stimuli, the brain might draw upon its own memories, emotions, and stored information to create a rich tapestry of internal imagery. However, it's also possible that these experiences are a result of the brain's attempt to make sense of its altered state. Section 6. Beyond the veil, sensory perception in the unconscious state. Sensory perception, the ability to see, hear, smell, taste, and touch, is fundamental to our experience of the world. But what happens to our senses when we fall into a coma? Research suggests that the brain, even in a coma, might retain some capacity for processing sensory information. Studies using EEG and fMRI have shown that certain areas of the brain responsible for sensory processing can still activate in response to external stimuli. For instance, some coma patients exhibit brain activity when presented with familiar voices, music, or even smells. This suggests that the brain might be able to receive and process sensory information at a subconscious level, even if the individual is not consciously aware of these sensations. Section 7. Trapped inside awareness and thought processes in coma. Awareness, the state of being conscious of oneself and one's surroundings, is considered a hallmark of human experience. But what happens to awareness in the context of coma? The question of awareness in coma is perhaps the most intriguing and challenging aspect of this condition. While some individuals emerge from coma with no recollection of any experiences, others report fragments of memories, thoughts, or emotions that suggest some level of awareness might have persisted. Some theories propose that consciousness exists on a spectrum, and different levels of awareness might be possible even in the absence of outward signs. However, determining the presence and extent of awareness in coma remains a significant challenge. Ethical considerations. Communicating with the unresponsive. The possibility of awareness in coma raises profound ethical considerations, particularly regarding the treatment and care of these patients. If an individual in a coma retains some level of awareness, even if they are unable to communicate, it raises questions about their rights, autonomy, and the potential for suffering. One of the most pressing ethical dilemmas is the decision-making process regarding medical treatment. Should families and medical professionals make decisions on behalf of comatose patients, or should we strive to develop methods for communicating with them and involving them in the decision-making process? These ethical considerations highlight the need for greater understanding of consciousness in coma and the development of reliable methods for assessing awareness and communicating with unresponsive patients. A glimmer of hope, medical advancements, and emerging therapies. While coma remains a complex and often devastating condition, medical advancements and emerging therapies offer a glimmer of hope for patients and their families. Researchers are continually striving to develop new treatments and interventions aimed at improving outcomes and enhancing recovery. One promising area of research is the development of neuroprotective therapies, which aim to protect the brain from further damage after an injury. These therapies often involve medications or interventions that reduce inflammation, stabilize blood pressure, or improve oxygen delivery to the brain. Another area of focus is the development of neurostimulation techniques, which involve using electrical or magnetic impulses to stimulate brain activity. These techniques have shown some promise in promoting recovery of consciousness and improving functional outcomes in coma patients. Advances in rehabilitation therapies are helping coma survivors regain lost function and improve their quality of life. The uncharted territory, unanswered questions, and future research. Despite significant progress in understanding coma, many unanswered questions remain. The nature of consciousness in this state, the possibility of subjective experiences, and the development of reliable methods for assessing awareness and communicating with unresponsive patients continue to be areas of active research. Future research will likely focus on developing more sophisticated brain imaging techniques to map brain activity in coma patients with greater precision. These advancements could help identify specific brain regions and networks associated with consciousness and awareness. Another promising avenue of research is the development of brain-computer interfaces, which could potentially allow individuals with severe brain injuries to communicate their thoughts and intentions. While still in its early stages, this technology holds immense potential for improving the lives of coma survivors. Ultimately, unraveling the mysteries of coma requires a multidisciplinary approach, combining insights from neuroscience, neurology, psychology, and ethics. Conclusion: the enigma of coma and the quest for understanding. Coma, a state of profound unconsciousness, remains one of the most enigmatic and challenging conditions in medicine. While we have made significant strides in understanding the neurological basis of coma, the subjective experiences of those in this state continue to elude us. Personal accounts from coma survivors, while subjective, provide valuable insights into the possible range of experiences, from the complete absence of sensation to vivid dreams and hallucinations. Scientific studies using EEG and MRI offer glimpses into the brain activity of comatose individuals, suggesting that some level of information processing and sensory perception might persist even in the absence of consciousness. As we delve deeper into the mysteries of coma, we must proceed with empathy, respect, and a commitment to improving the lives of those affected by this condition. The quest to understand coma is ultimately a quest to understand the human brain and the nature of consciousness itself.